A stroke is a clinical condition that results from either a blockage of the blood vessels that supply blood to the brain or the spinal cord, or as a result of the rupture of the vessels supplying blood to the brain. This results in either a change in the sensorium of the person if it happens in the brain, or it can also result in what we call a motor deficit, like weakness of one part of the body or the other. Ischemic stroke, which is the more common type, tends to be common in people who are elderly. Usually happens maybe in the early hours of the day, and it's not painful. Unlike the hemorrhagic stroke that can happen during activity, when there's sudden increase in sympathetic activity. It can also happen whether a person is elderly or younger people, but it tends to be commoner, in elder people. But ischemic stroke is the one that's commoner in people who are older persons. People who are younger than 5 years, whether they're middle age or young or they're teenagers or immature, they can also have a stroke, right? As one ages, the risk of stroke, increases. Every 1 in 4 persons who have had a previous stroke is most likely to have a second stroke.
Welcome to another episode of Health Conversation with Dukes. My name is Ahiwe David, and this is episode 7. And with me, we have the experienced, the seasoned, the world-renowned neurosurgeon, Dr. Iwagu, with me. Dr. Iwagu, it's so nice to have you today on this episode with us.
Yeah, thank you very much. I'm happy to be here too. Thank you very much.
All right, so on this episode, we're going to be taking a deep dive into stroke. What is stroke? We're going to be taking a thorough explanation into the rubrics of what is stroke entailed with the neurosurgeon on today's episode. And then on today's episode, we're going to be exploring a lot of possibilities. What does stroke look like? What does the post-op recovery look like for stroke? All right, sir, let's start with the first question.
Okay.
What exactly is a stroke? Now, people tend to have a vague idea of what a stroke looks like. This is a stroke, this is a stroke. What is a stroke medically?
Okay, thank you very much for that question. So a stroke is a condition, a clinical condition that results from either a blockage of the vessels, the blood vessels, that supply blood to the brain or the spinal cord, or as a result of the rupture of the vessels, supplying blood to the brain and the spinal cord. And this results in either a change in the sensorium of the person if it happens in the brain, or it can also result in what we call a motor deficit, like weakness of one part of the body or the other. It can even result in a sensory deficit, that is, abnormal feeling or sensation of the body. It can even result in autonomic deficits. So essentially, it has to do with it's a vascular event. It has to do with injury to the brain or spinal cord, which results from either a blockage of the vessels supplying blood to the brain or spinal cord, or a rupture of the vessels so that the blood leaks out, from the blood vessels into the brain substance or the spinal cord, and this eventually, will cause deficits in the patient. So that's what a stroke is, essentially. And stroke is a very important condition, clinical condition, not just in Nigeria but worldwide. In 2021, the World Health Organization reported that the number of new cases of stroke that's reported was 11.9 million worldwide. And that is really significant. Okay, and stroke was also reported there to be the 3rd leading cause of morbidity and mortality. That is the 3rd leading cause of death around the world, as well as morbidity. Okay, and to even make the picture worse, it was also reported then that stroke, that 1 in 4 persons, will develop stroke in their lifetime. So that paints, the seriousness of what we're talking about, how important it is. So essentially, stroke is a very, very important disease that people need to know about, is how to identify them, and also what to do when they identify that someone has had a stroke. Okay, so I think it's very, very important condition that people need to know about.
All right, you mentioned something about sensory deficits. I'm very curious. I'd like to know how does stroke present? Are there different types of strokes? What are the symptoms? Does a particular type of stroke, is it more prominent in certain types of people? So how do strokes present generally?
Okay, thanks a lot for that question. So there are two types of stroke, right? So there is the first type that's caused by a blockage of the blood vessel that carries blood to the brain or the spinal cord. So that's what we call an ischemic stroke. And the other type where the vessel ruptures and the blood leaves or leaks out from the blood vessels into the substance of the brain or the spinal cord. That would then cause what we call a hemorrhagic stroke. So ischemic stroke is the more common type, compared to the hemorrhagic stroke. And of course, the way they present is, the temporal profile, the way they present, look different. But of course, they eventually would present with the same deficits. Okay, essentially, for the ischemic stroke, which is the more common type, tends to be common in people who are, elderly. Usually happens maybe in the early hours of the day, and it's not painful. Unlike the hemorrhagic stroke that can happen during activity, when there's sudden increase in sympathetic activity, okay, and then the pressure in the blood vessels causes the blood vessel to rupture, and then blood leaks out into the brain substance of the spinal cord, and then that can cause a stroke. That is found in like 10% of persons, and it can also happen whether a person is elderly or younger people, but it tends to be commoner, in younger people. Okay, it tends to be commoner, but ischemic stroke is the one that's commoner in people who are older persons, and it is the more common type of stroke, right? Now there is a third type, which we call the transient ischemic attack. Now this is not like a stroke in a quote. Now, because it's usually caused by a blockage of the vessel supplying blood to the brain or the spinal cord. But the unique thing about a transient ischemic attack is that the symptomatology resolves within 24 hours. And so once that happens, usually the person will say, person may develop a deficit, and then before the deficit disappears, and then the person gets normal again. So that is what they call a transient ischemic attack. Now, but the thing about the transient ischemic attack is that even though it is not like a major stroke, as it were, it is a warning sign to that person that something sinister would happen soon. Okay, so it's very, very important that people understand that if a person have a transient ischemic attack, that it's a warning sign that they're likely to develop a major stroke, soon. Thank you.
All right, thank you. What piqued my interest in what your response, your answer now? You mentioned TIAs, that's transient ischemic attack.
Yes.
Now, for people that experience this, we can call it maybe mini strokes, or I don't know if you can call it mini strokes or something like that. For people that experience this mini strokes, what is the next step of action? What's the next line of action that they should do to, in order to ensure that maybe it doesn't happen again, or to like a corrective measure to ensure that these TIAs don't happen again?
Okay, to answer that question, very well, I would like to just talk about risk factors for, stroke, because, it's important to understand that there are factors that predispose one to developing a stroke. And whether it's like a major stroke, in quotes, like we've talked about ischemic and hemorrhagic, or even TIA, there are risk factors that predispose a person to that. And then I would then dive into saying, okay, if this is noticed, this is what you should do. So first of all, what are the risk factors? So the risk factors for stroke may be divided into two broad types. Okay, so two broad classes, right? So there is the non-modifiable risk factors, and then there is the modifiable risk factors. So non-modifiable risk factors means that these risk factors cannot be modified. You can't do anything about it. You understand? That's what non-modifiable means. Modifiable risk factors means that these risk factors can be modified. That you can't do something about them, right? So let's talk about the non-modifiable risk factors. Now, one of the non-modifiable risk factors is the age of the person. You can't change your age, right? Yes. So as you're aging, you can't bring your age down, right? So you can't reduce it. Yes. Yeah, so age is one of the non-modifiable risk factors of a stroke. As the person gets into their 50s or their 60s and above, the risk of stroke tends to be higher, especially ischemic stroke. Sure. But of course, they can also have hemorrhagic stroke. But I said ischemic stroke is more common, right? So, but it's important to also understand that even young people and children, and when I mean young people, I mean people who are younger than 65 years, whether they're middle age or young or they're teenagers or immature, they can also have a stroke, right?
Even teenagers.
Yes, young people can have a stroke, but it's not as common as people who are elderly, yes. Right? So that's why I said age is important. So as one ages, the risk of stroke increases. The second non-modifiable risk factors I'd like us to talk about is what's what we called a previous stroke. So if someone has had a previous stroke, right, you can't do anything about it. It has happened, right? So you cannot modify it. In fact, it is once the person has had a previous stroke, the risk of having another stroke in the first 3 months, is about 3 to 9%. So that, in the first 3 months after a previous stroke. After the first 1 year, it increases to 10 to 15%. And in the first 5 years after the person has had a previous stroke, that risk increases to about 20 to 30%. Do you understand? And in fact, every 1 in 4 persons who have had a previous stroke is most likely to have a second stroke. You understand? Yes. So that's why it's important to understand. So having had a previous stroke it puts that person at risk of having another stroke. So that's why stroke is something. It's a lifelong management. You need to treat the person and ensure that the person does not get a second stroke, because the second impact can be worse than the first, right? So it's not only having a previous stroke. Now, if a patient has a heart failure, someone has had a heart failure, maybe due to atrial fibrillation or any other cause, the failure has happened, right? So that puts the person at risk of even having a stroke, because the person is likely to throw an embolus, to the brain, okay, even to the cord, and the person can even have a stroke. Now, of course, some people talk about sex, but really, that stroke can either happen in males or females. So the more important non-modifiable risk factors, the age of the person, and the previous history of the stroke. Now, what are the modifiable risk factors? The modifiable risk factors are those things, like I said earlier, that you can modify, right? So one of the modifiable risk factors is hypertension, systemic hypertension. Someone who is hypertensive. So the reason why it is modifiable is because you can treat hypertension, you can control the blood hypertension, so that the blood pressure is within a range that does not that does not predispose the person to have the stroke, right? So hypertension is one of the modifiable risk factors. People who have diabetes mellitus, can be treated. Another modifiable risk factors is weight, the weight of the person. The person is obese or even overweight, it's also it puts the person at risk of developing a stroke. And you can control your weight, like do some activities that can reduce your weight, like exercising, also doing dietary modifications to help reduce your weight. So that is also another modifiable risk factor for stroke. Then also, sedentary lifestyle is also a modifiable risk factor. So, you can actually avoid being sedentary by going out to work, being involved in exercises. So sedentary lifestyle can be prevented. So that means it's also a modifiable risk factor. So these are some of the modifiable risk factors. Now, there's also a modifiable risk factor I want to mention. I think we've talked about it in one of our podcasts, which has to do with aneurysms, intracranial aneurysms. Okay. And so this is just a condition in which, there's an abnormal outpouching of a wall of the blood vessel, especially a weak point in the blood vessel. This weak point, when it outpouches, it can, also rupture and then can cause the person, a stroke, right? So it is a treatable condition, either by clipping or coiling, and we do that in Duke's Neurosurgeon Hospital, right? So that is also a modifiable risk factor. So there are lots of modifiable risk factors. But what's important is that, people need to understand that the modifiable risk factors are like they account for, most of the stroke conditions, right? They are more, their impact is more with respect to, putting patients at risk of developing stroke. So if one can, control these risk factors, then they can reduce the risk of developing stroke. Now, so like you then ask, so if someone develops a transient ischemic attack, I did say earlier that it's a warning sign that, something sinister will happen. So the first thing is, how do you even know that you've developed a TIA? So now there are symptoms, common symptoms. Now, one of the symptoms, one may notice is either a change in their balance, okay, that they are not able to walk well. They know they are walking and they are either tilting to one side. You understand? That's what we call gait imbalance. They may have gait imbalance. They may have drooping of one part of their eye, their eyelids, okay, or they may even have, visual impairment, maybe changes in their vision on one side. That may be a pointer to a stroke. Also, it could also be drooping of one side of their face. The mouth is drooping to one side, or one part is drooping to one side. If you notice that kind of thing, that person may have had a stroke. And not only that, they can even have weakness in their arms or their legs, like, having weakness on one side of the body. Of course, that in itself can also affect their walking and their gait. Yes. So those are some of the symptoms. Then slurring of the speech. You notice there's a sudden, change in the way you talk, right? Your speech is slurred. You're unable to pronounce words the way you're pronouncing before. That may be a pointer that person has had a stroke. Even having numbness in one part of the body that happening suddenly, affecting one part of the body, that may also be a pointer to a stroke. So if you notice this thing, and of course, you then notice that within some hours, that let's say the person noticed there was drooping of the one side of the face, or even the one side of the body, and the person noticed that, so within a day, the symptom resolved, that is a pointer that the person had a transient ischemic attack.
Yes.
So some people will just relax and say, oh, well, nothing happened, right? They will just stay back without going to say doctor. But that is not correct. That is not the right thing to do. The right thing to do is to go and see the doctor. Even if you've had a symptom, that points to a stroke and you got better, don't stay at home. Don't say, oh, I'm fine and everything. You need to go and see a doctor, a specialist, because that may just be a warning sign telling you that something worse, would happen in the future. And if you don't get yourself treated, when that sinister thing happens, it will then affect your life, your activity of daily living. It will impact on it severely. So my advice to anyone who develops any symptom, okay, suggestive of a stroke, is that the person should go to the hospital immediately to see a specialist. And even if the symptoms resolve before a day, still go and see, the specialist so that they can treat you, they can evaluate you, they can, do some investigations, and then at least give you a clean slate, say, oh, you can go ahead with your daily work, but pay attention to this. So it's important. It's actually safe to do that. And that would be my advice to everyone listening to this podcast. Yes, thank you very much.
All right. Thank you so much for that insightful answer. It was very, very, you said a lot of things. You passed across a lot of information. Now, there's something I picked in. You mentioned something that had to do or revolve around heart attack or heart failure. Now, for those watching, for those listening at home, people don't know that this particular condition, stroke, is even as would I say, is as deadly as a heart failure or heart attack.
Yeah.
And then I want you to hammer on the importance of going to a specialized facility to be able to go for your checkups for stroke. And then also, I also want to add this question, okay? Because I know people want to also know, is stroke treatable? All right.
Yeah. Thank you very much for that, Chris. I mean, that's so wonderful. Yes, like you rightly said, stroke is as serious,
yes,
as someone having a heart attack, and you need to give it an emergent attention, right? Just like when someone has a heart attack, it means that there's blockage upon vessels supplying the most of the heart, and then of course when that happens, the heart would beat abnormally, and then can feel that can lead to the heart failing to function. The person can die. In fact, what it simply means is that when a heart attack happens, that person can die. The same thing when a stroke happens, it can lead to the death of that person. So that's why it's very, very important, right? Now, stroke is something that you need to give all the attention, that it requires, because every time counts. The more you waste time, the worse it can become.
Right from when it presents.
Yes, but right from when the stroke actually happened.
Okay.
Yes. Okay. So let me just put this across. I will just try and explain. Now, when a stroke happens, for example, there are two parts, that are affected. The part that is supplied by that blood vessel, okay, that part usually receives the most impact. We call it the umbra. Then there is the part just immediately after that umbra. We call it the penumbra. And that's the part that, is not as badly affected as the umbra. So the cells in the umbra, the brain cells in the umbra, usually are dead cells because they don't receive blood supply. They're going to die, right? But the penumbra are the next slide. So if nothing is done about that stroke, it will evolve such that the penumbra will then be affected and the cells there will also die. And the penumbra will be converted to an umbra, and then a new penumbra will form. So that's what happens. So it can progress, you understand? So that is why it's important to get treatment, immediately. So the more the person delays getting appropriate treatment, the higher the chances that, the evolution of that stroke, can get worse. And of course, the impact on that patient's life would also, get worse. You understand? So it's important that people pay attention to it and see a specialist immediately. Now, is stroke treatable? The answer is an emphatic yes. And in fact, the hospital where I work, that is Duke's Neurosurgeon Specialist Hospital, we are, Center of Excellence for Neurosciences, so we have expertise for neurosurgical care, neurology, physiotherapy, neuro rehabilitation and critical care, which is, what we need to take care of people like this. So if you have a stroke, or you know someone who has had a stroke, why don't you come to a center? We have all the facility to attend to, to treat you and ensure, that you have your life back, right? So I'm going to advise you to see a specialist. If you're living in Lagos, outside Lagos, and you can come to Duke's Neurosurgery Hospital, yes, that will be a big plus, because there you have access to specialized facilities, specialized facilities for your treatment and your rehabilitation. Because one thing about stroke is not only that you're treating the stroke, but of course rehabilitation is very important. So, and we have the facility. But if you have specialists who are close to you where you live, my advice is that you should go to those specialists, because they are closer to you, and you can also get similar treatment from them. But if you don't have, you can come to Duke's Neurosurgery Hospital, and you will get specialist care. That is if you've had a stroke, or you know someone who's had a stroke. Yeah. So emphatically, stroke is treatable and is being currently treated in Nigeria and in our hospital. In fact, we've treated a lot of people who've had stroke in our hospital. Yeah. Thank you very much.
All right, thank you so much for that answer. For those of us that are still at home watching, listening, would like to know if at all there are any lifestyle activities that we can practice for those that do not have stroke.
Yeah.
But then also want to find out if at all there are any preventable lifestyle activities, lifestyle changes that we can indulge in that can, let's say, prevent this occurrence of stroke.
Oh, thank you so much. Now, importantly, when I talked about the modifiable risk factors, I mentioned some things. The other things I didn't mention, which I want to mention now, is, of course, dietary modification, like limiting the amount of sodium, the salt intake, you take per day, and also stopping chronic tobacco use and chronic alcoholism. You understand? These are all modifiable risk factors. So, the things that one can do, to reduce their risk of having a stroke is to ensure that they modify those risk factors that I said they are modifiable. So what are these risk factors? I'm going to list them again. So number one, we talked about hypertension. So if you're hypertensive, you're currently hypertensive, you need to make sure you are seeing a cardiologist or a nephrologist, and you're treated for the hypertension. You ensure that you're taking your antihypertensives and your blood pressure is well controlled. Some people take the antihypertensive and after a while they stop. They say, oh, I'm tired. So the treatment for hypertension is a lifelong treatment. You don't say, oh, I stopped, right? I feel I don't have hypertension again. No. So the only time you are advised to skip an antihypertensive is if your blood pressure is low on the low side, especially if it's less, if it's 130 over 80 millimeter mercury and lower than that. You want to skip it because you don't want the antihypertensive to make the blood pressure go into the hypotensive rate rise. But beyond that, you need to check it regularly. Once it's higher, you take your antihypertensive. So my point is that the treatment is lifelong. You don't stop it on your own, right? So you need to always see a doctor, and the doctor would give you appropriate advice. So controlling hypertension is one thing. Then another thing one can do is also controlling the glycemic level, especially for people who are diabetic, and they are on, if you're diabetic, you are not on anti-diabetic drugs, I advise you to see a doctor, and who should see you and recommend appropriate anti-diabetics to control your blood sugar, because, when diabetes is not controlled, it can alter the metabolism of glucose in the body. And, that can also lead to what we call atherosclerosis, arteriosclerosis. Now, all these are changes in the walls of the blood vessels, and these can impact on the blood supply to the brain, and of course, increase the risk of that person to a stroke. So, controlling the blood sugar level if someone is diabetic is very, very important. That's one of the things someone can do. Now, reducing your smoking habit. Yes, reducing your smoking habit is another thing. If you're smoking, you're smoking for several months, several years, I advise you to see a therapist if you can't stop it on your own. But if you can't, you start reducing, your smoking, the number of cigarettes you smoke per day. Once you start doing that, you are likely to be able to stop smoking. Then also reduce the number of the quantity of alcohol you take, and yes, trying to reducing that would also help reduce your risk of having a stroke. Then also dietary modification, limiting the amount of salt you take. So what is recommended is a a teaspoon. That's a level teaspoon, 1 level teaspoon of salt per day for an adult, and that's about 1,500 milligrams of sodium. Yeah, so that's the daily requirement, to reduce your risk of developing a stroke. The other things basically that one can do is to exercise. It's recommended that you should do about 150 minutes of moderate to intense exercise every week, to also help reduce your risk. So these are some of the things people can do to reduce the risk of developing stroke. Yes, thank you.
All right, thank you, sir. This has been so educative. This has been so insightful. I'm sure those of us listening, those of us watching at home, we've been able to pick up one or two things. I personally have been able to pick up one or two things from this particular segment. And that brings us to our final question. Now, our final question is, what does the treatment of stroke entail? What does the treatment of stroke entail? And then also, what are the popular myths that surround this particular condition called stroke, and how are they debunked? All right, sir.
Yeah, okay. Thank you very much for that question. So you should see a specialist, right? So the specialist is going to listen to the story about what happened to you, and of course, would then examine you to corroborate the signs, okay, of the stroke, and then also would then investigate you. So there are lots of investigations, that can be done and usually are done. But the commonest one, the most common investigations we do rather are the brain MRI, so brain magnetic resonance imaging, as well as a computerized tomographic scan, a cranial computerized tomographic scan, and sometimes we could also do what we call a brain computerized tomographic angiogram or angiography, right? It was called CTA. So essentially, this imaging modality or imaging studies will give us information of what part of the brain was affected, and it will also help us decide whether we need to get the type of care. It will tell us whether it's an ischemic stroke that person had or hemorrhagic stroke. It will just help us corroborate that. It will also help us, plan the care for that patient. Now, the care for a patient, like I said earlier, there are other investigations that are done, right? But I've just mentioned the more common ones. So the treatments for stroke can either be non-operative treatment or operative treatment. So the non-operative treatments include the use of medications like anticoagulants.
Okay.
Anticoagulants essentially blood thinners.
Blood thinners, yeah.
Especially for patients who have had ischemic stroke, you want to thin out the blood. The plan is to try to revascularize, to reopen the blood vessels that have been blocked, so that blood can flow again in the brain, in a bit to treat the ischemic stroke, right? So they use blood thinners, and there are a couple of them, like sulfite, clopidogrel. These are some examples. Then it's not just the blood thinner. There are also medications that also help the affected neurons to recover. It helps, right? Drugs like acetylcholine, Tocovid. So these are some drugs that can also be. Other things that could be done is the use of what you call thromboembolic deterrent stockings, so intermittent pneumatic compression devices, which tend to prevent blood clots in the legs of the patient, which of course is also can lead to formation of thrombus, which if it embolizes can also cause a stroke. So we try to prevent that, right? Then the patients would also have physiotherapy, physical therapy, especially because stroke patients have weakness in one part of the body or the other. So you need to exercise that part. So this is where the physical therapists come in. And in fact, this is part of the rehabilitation for such patients. It starts from the point the patient presents to the hospital. So these are some of the treatment, non-operative treatments that we've done. Then if the person has pain, of course, we need to give analgesic to treat pain. Also intravenous fluid, especially in the acute phase, when the person presents, we give intravenous fluid. You want to improve the blood rheology. That's what's called, right? So we do that. So these are some of the non-operative treatment we can do, or we do for patients that have a stroke. Then there are some times when the patient may have bled into the brain, okay, and requires a surgical intervention. Or it could also be that the patient has an ischemic stroke, and of course there's massive brain swelling, requires some control of the intracranial pressure. So you can then do a surgery. There are different kinds of surgical interventions. So we have what we call a craniotomy and evacuation of hematoma. That is if there is blood clots in the brain massive, and in requiring surgical intervention, we need to remove that, make an opening in the brain. I mean, in the bone of the covering the brain, that's the cranium, and evacuate the blood. Some people may require what you call a craniectomy, whereas you just remove the bone and don't replace it, allow for brain swelling to occur, so that the pressure within the intracranial cavity, will be well controlled, and over time the brain will then start recovering, right? Now, some people have also done minimal invasive surgery, especially when the blood clot is not that much. They can do a borehole, and then they can either use a stereotactic device, which is like a device using computerized calculation to localize the location of blood and evacuate it. Okay, so these are possible interventions. Then patients who have a massive blood clot in the veins in the legs, okay, can also have what we call a mechanical thrombectomy. Whereas in this mechanical thrombectomy, an interventional radiologist can pass a guide wire through the vessel, get to that where the thrombus is, and then remove it. Essentially, you want to prevent it from getting to the heart, because if it gets to the heart will send it to the brain or spinal cord, and that can also cause stroke. So these are some of the treatments that can be done. The other part of rehabilitation I need to mention is what you call speech therapy, right? So it's not just that the muscles of the limbs have to be exercised. The person has to also, be trained on how to talk again, because of course that stroke could have impacted on the speech. So the speech therapy comes in, helps to exercise the muscles of articulation, and also help the person to kind of train the person to be able to talk again. Do you understand? The physiotherapist will try to help the person to learn how to walk again, strengthen the muscles, and why the speech therapy will help with the speech. So these are things that can be done, and they're all part of the treatment. Then quickly, let me just finalize by talking about the myths. Okay, so I've mentioned a couple of myths, but I'm just going to reiterate. So number one, people think that stroke can only affect the elderly people or people who are old, right? So that is a myth. It's not correct. I've mentioned earlier that stroke can also affect young people. In fact, 10 to 25% of stroke affect young people, right? So, but of course, like I said, it is commoner in elderly people, right? So that's one of the myths that people need to understand. And also, people think that when they have symptoms of stroke and they get better, they don't need to go see a doctor. I also say that is wrong. It's a myth. So even if you feel you're better, still go and see a doctor, because it's sometimes these people may have gotten better, but the blood vessels supplying the brain, what's called the carotid arteries, may actually be narrowing. And sometimes if you go and then do what's called a Doppler ultrasound scan, it will help identify this narrowing. And of course, they can either have what you call an endarterectomy, or the vessel would be recanalized. Okay, so that's also a surgical procedure that can be done. So that's why it's important, because if you don't go to the doctor specialist, you would not know that the vessels have been narrowed and something needs to be done about them. Do you understand? Also, another myth is that people think that, if someone has a stroke, it has to be painful. You don't need to have pain. Okay, for you to say, oh, a stroke has happened. Like I said, if an ischemic stroke, most times person will not develop pain. Right? If it's hemorrhagic, the person is likely going to have an acute pain, right? Sudden headache, especially if it's cranial, right? So these are some of the myths that need to be debunked. But all in all, I think the takeaway message right here is that stroke is a disease that is common amongst us, and it's important we're able to identify it like we've talked about. And when you identify, please go and see a specialist for treatment. And don't say if you have had a stroke and symptoms are disappeared, don't say, oh, you shouldn't go to see a doctor. No, please go and still see a doctor, okay? Because that stroke that happened, what you call it TIA, it's a warning sign that something sinister is going to happen. So I think that's the takeaway message. People should seek help. And we in Duke's Neurosurgeon Specialist Hospital, we provide that level of expertise. And we encourage you to come to our hospital for care. And I assure you're going to have the best. Thank you very much.
All right, thank you, sir, so much for this particular episode has been so insightful. Like I said before, it has been so educative to those of us listening at home, to the young, to the old, to the middle age. I want you guys to be able to understand that this particular topic, this particular episode on stroke, it affects each and every one of us. So we should pay attention to the symptoms if they present, when they present. Show up at the hospital, present to the specialist, and to be able to ensure that you get the best of care. All right, that brings us to the end of today's episode. Thank you guys for sticking with us, and I hope you learned something, because I know I learned something, and I know people too learned something. So thank you guys so much for sticking with us on today's episode. See you on the next episode.